Hello, my name is Deborah Bergfeld. I'm a specialist in physical medicine, rehabilitation, and also sports medicine. I chose to go into healthcare because I was really interested in science, and particularly natural sciences, and I actually initially went down the road of primary research, actually cancer research. And that's a pretty daunting field in that it felt relatively isolated. I was in a lab working with cells on an immunologic and cellular level, and it really sort of prompted me to realize that I needed a lot more person-to-person interaction. And that's really what ended up driving me into healthcare and then ultimately into the field of medicine within that. So I chose my specialty of physical medicine and rehabilitation because one of my best friends is actually a physical therapist. And I had looked at many different fields, including neurology, internal medicine, and she introduced me to this field. And what interested me the most was that no matter how devastating an illness or whatever someone was dealing with in their life, physical medicine and rehabilitation dealt with function. So we look and work with a lot of people with underlying disease conditions or limitations in their life, but we really kind of focus on function and the sorts of things that they'd like to be able to do that they're not able to do. I'm actively involved in training residents currently, which I think has been a real evolution in my career that I've appreciated even more. And secondly, as far as my career trajectory is right now, the endeavor that I'm the most excited about is actually blending my world of as a rehabilitation specialist along with the sports medicine. And so we're working in the realm of something called adaptive sports and wellness, which is working with people who have disabilities, challenges in their life, but allowing them different avenues to engage in sports and recreation in the community. And so we're working really hard on getting that sort of program off the ground. When you work with patients who may have challenges that able-bodied patients don't, to see them be able to achieve things they never believed they would be able to because maybe they are in a wheelchair, or they have been in a wheelchair for the majority of their life and they never thought they could compete in a racing event, or they never thought they could ski, snow ski. Those are the kinds of things when we introduce those sorts of quality of life just goals into patients' care that I think I appreciate the most.